Hello, I'm Lisa Ling. This is The Road to a Vaccine, an exploration of the COVID-19 crisis and the global community's efforts to develop a vaccine against the disease. This past week has been historic, to say the least. While the US and much of the world has been focused on the presidential election, the COVID-19 pandemic has continued to worsen quite exponentially. In fact, I am again quarantining after getting exposed to someone who tested positive for COVID this week. So hopefully I'm not going to have any technical glitches today. Let's take a look at the numbers. Currently, there are over 50 million global confirmed cases and over 1.2 million global deaths. The US currently is in the midst of a surge and has surpassed 10 million confirmed cases. The 7-day average exceeded 100,000 cases per day, more than any other country. With the US presidential election signaling a new era, President-elect Biden is assembling his coronavirus task force and has vowed to take an approach based on science. That is hopeful news in a time when the line between politics and public health has been blurry since the early days of the pandemic. In Utah, Governor Gary Herbert declared a state of emergency and issued a mandate for all residents to wear masks in public. Meanwhile, the UK, France, and many regions in Italy are again on lockdown. France's health minister warned the second wave could be worse and longer than the first. Schools and businesses there are still open, but people need permits to leave their homes. Officials have suggested the lockdown might extend into the holidays. But there is some promising news. Just yesterday, Pfizer announced their vaccine candidate has been 90% effective at preventing COVID-19. Today, we have an incredible lineup of women who are incredible themselves, taking on this pandemic from different perspectives. Dr. Allison Schwartz, an infectious disease specialist in Wisconsin, one of the hardest hit areas right now, will shed some light on what it's like to be in the epicenter of an outbreak. Then, if you've ever wondered how today's youth are responding to the current situation, we have 14-year-old Anika Chabrullo, winner of the 3M Young Scientist Challenge, who took matters in her own hands and discovered a potential COVID treatment. She is absolutely phenomenal. And finally, renowned ER physician and advocate Dr. Uche Blackstock is here to discuss COVID's impact on people of color and the inequities that lead to poor health outcomes. We are coming to you live, and we invite you to put questions in the comment section, and we will do our best to get them answered as much as we can. Now for our first guest. Over the weekend, Wisconsin's coronavirus infections hit a new daily high of more than 7,000 cases. Hospitals are so overwhelmed with patients that the state has set up a field hospital at the State Fair Park. Here with more on the situation is Dr. Allison Schwartz, infectious disease specialist at SSM Health in Madison, Wisconsin. Dr. Schwartz, thank you so much for taking the time to be with us. I know so many healthcare workers there are so overwhelmed. Now, you are an infectious disease specialist in Wisconsin, which is one of the most hardest hit regions in America right now, with more than 50,000 cases. Can you give us a sense of what is happening there, and what do you think is causing the spread and continuing its increase?
Sure. Hi, Lisa. Thank you so much for having me today. I certainly appreciate the opportunity to speak with you and speak about the experiences here in Wisconsin. So as you mentioned, unfortunately, here in our state, we are hitting record numbers. It seems like every day, a new record. And so now all 72 counties in Wisconsin are considered to have very high levels of circulating virus. You mentioned this weekend where we hit a record number of 7,000 cases in a day. Of the past 5 days, actually 3 of those days, we've had record numbers of cases. And so these are very troubling numbers that we're continuing to see. And I think it's important to recognize that as we see the numbers go up with cases, we'll see the lag in hospitalization. So within the next couple of weeks, although our hospitals already are in this surge mode, we fear that things may even continue to get worse over the course of the next couple of weeks. I think there's probably several things contributing to these trends. Our governor did take action early on when we saw the numbers starting to go up and did recommend a mask mandate for our state. This was unfortunately challenged in some of our higher courts, and there's this element of public buy-in and public faith that we need to have in our officials who are making these recommendations for, their safety, the safety of our friends, family, and neighbors. And unfortunately, I think there was a lot of resistance to that early on. Going back to March and April with the pandemic, our state was like many others. There were small clusters of outbreaks, maybe related to like meatpacking plants, for example, up in the Green Bay area. And then over the summer, our numbers sort of came down and everyone started to let up their guard. And by Labor Day, we've seen more gatherings. Now, a lot of the cases we're seeing and some of the cases that we've been involved with, or me personally, will be things like weddings, funerals, birthday parties, all the things you're hearing about on the news. And it's definitely true and it's definitely real. And, it hits home when you see a case where it's like maybe a pre-symptomatic or asymptomatic younger family member brings home the disease and ends up infecting other family members, and a grandparent passes away. It's been, troubling to see those trends for sure.
Dr. Schwartz, are there many people in the ICUs of hospitals, and how are hospitals and healthcare workers doing? I mean, I've read that hospitals are over 85% capacity. And I just wonder if you can describe the strain that this is having on the healthcare system overall.
Sure. There's definitely, we've come a long way since the beginning of the pandemic. And I think although the volumes of patients that we're caring for has gotten much higher, we're able to care for those patients in a much more organized fashion than we were able to early in the pandemic. We have, better treatment algorithms, and people are coming in sooner, and so trying to prevent some of those long ICU stays. But again, as the numbers continue to increase and patients end up in the hospital, sometimes for very prolonged periods of time, there's definitely a trickle down. And even outside of COVID, we've seen the impact within our state where a patient who needed to go to one hospital, that hospital was full because of COVID, they may end up getting shifted elsewhere. The utilization, as you mentioned, of this field hospital is also something that we've had to use in certain circumstances. There's been a lot of collaborative efforts between the different healthcare systems within our state to curb the numbers and make sure that we do have bed availability for patients. But I also think it's important to acknowledge that this has taken a huge toll on our healthcare workers. And something else we're seeing, my healthcare system, we have not had to deal with this yet, but it's something we're preparing for. As the community spread continues to increase within our state, we're seeing staff members go out, staffing shortages, hospitals that are needing to delay things like elective procedures because of things like staffing shortages, just because of the greater community impact of the disease. So it becomes very challenging where we say, we may have a bed for you, but if we don't have the appropriate staff to care for you, that's a whole nother set of challenges. That is something we're continuing to face and will become more evident as we move into these winter months. And then along with that, even the staff we have, I think there's an emotional toll that all of this has taken on our healthcare workers. That's everyone from the physicians, obviously our nurses assistants, all the way down to, phlebotomists, our environmental services staff, food services people, everyone in the hospital is affected by this. And I think, having been in the thick of it since March, we can all uniformly say, no, the public is tired of all the measures that we're recommending, but we're also tired. It's very hard going to work and taking care of these very sick people in a unique set of circumstances where their families can't be at the bedside. We've had to get creative with technology and iPads, trying to get families involved so they can see their loved ones, but it's a whole new set of challenges that is unlike anything we've seen before.
Yeah, I mean, I think that the public tends to forget or not think about the fact that healthcare workers have been on the front line since day one, and it has been so overwhelming, and have been taking incredible risks themselves. As someone who has been on the front lines, as someone who is on the front lines currently, what would you say needs to be done to curb the spread of COVID in Wisconsin? And what would you suggest other states do in order to keep their cases under control as well?
I think, it really goes back to the basics that our public health experts have been recommending since the beginning. And sort of what I would like to emphasize is I've heard a lot of talk from people who say, I understand the risk, and if I get sick, so be it. But I think that people need to start thinking outside of themselves. And that's the unique piece of this disease. So much of the spread is occurring either in that pre-symptomatic phase before patients realize that they're infected, or there's a certain subset of patients who actually may shed the virus asymptomatically. So although you say, I understand the risk, and if I get sick, I guess I'm okay with that, or whatever the thought process may be, you need to, think outside of yourself, think about your neighbors, that elderly person at the grocery store, all the healthcare workers who, as you mentioned, are putting their lives and their families on the line, and, our own mental and physical tolls that it's taking, and try and re-engage the public that it really is not as much about you, but about everyone as a community, focusing on, the mask wearing, the hand hygiene. I like kind of the shift away from the idea of social distancing, but rather to call it physical distancing, because we want people to feel socially connected, but physically distanced, to keep yourselves and everyone else around you safe, and sort of look at other parts of the world and see that there are places who've, been able to adhere more with these measures and get their curves back under control.
Certainly, there are entire nations that have been
Yeah.
very vigilant about adhering to the guidelines and have, in some cases, successfully combated the virus and
Mhm.
have had, in some cases, no new cases in many, many days. We talk about this pandemic fatigue after so many months of social distancing. Now we're heading into the winter months. It gets so cold there in Wisconsin. What would you say to people watching to help them prepare for this upcoming winter?
Sure. I think the upcoming winter certainly is going to be a challenge. And I would say in Wisconsin, we're resilient people. We're used to the cold. We can do things outside, and we just need to embrace it in a new light here. I think that the strain on our healthcare system is going to be augmented in the winter, because this is already a time of year where we see increased hospitalizations related to, we talk about influenza, we talk about other respiratory illnesses, GI illnesses, et cetera. To add the strain of COVID on top of that is another factor that really we just need to re-engage the public on, to recognize doing all the measures that I just mentioned, getting your flu shot, protecting yourselves and your families, to get through the winter months, and, bundle up and go outside and enjoy a winter hike. Traditions are going to look different at the holidays this year, but it's just one year. And if it means keeping your family safe and keeping others around you safe, then certainly it seems worth it in the long run.
I'd be remiss if I didn't mention the consequential election that just happened. Many people were looking at Wisconsin, right? It was a swing state that ended up flipping. What do you think COVID, like what was the role that you think COVID played in how people voted in the state of Wisconsin?
That's a good question. I think it's hard to exactly say. I would like to think that people were able to see the pandemic and how it was handled at a governmental level, and maybe that did impact the way they voted because they lost a family member or know somebody else who lost a family member, to some degree, that it may have had an impact on the way our state voted this year, because we certainly have been so hard hit here.
Dr. Schwartz, I have a question from Joanna from LinkedIn who asks, can we address the spread from those who are asymptomatic? How can we address the spread?
Right. I mean, that's the big question. If you're asymptomatic and you don't know that you have the virus, then you could be shedding and infecting other people around you. So that's where we know the mask wearing is so important. And that's one of the reasons very early on we came forward with the idea of wearing masks in public so that you are not shedding virus to those around you. I think there's other developments that people will continue to talk about, more widespread testing and other rapid tests. If we were able to do what some other countries have done and identify that subset of the population who may be asymptomatically shedding, then we could appropriately, isolate or quarantine those people so that they know that they truly can't be going to work or can't be doing these other things, and therefore, unknowingly spreading infection to those around them.
Yeah, I have to also add, as someone who has quarantined twice now, If I were to take a test now, I would probably be negative, and that's because it might take the virus
Right.
a number of days to incubate until I'm shedding. So that's something people really need to recognize, that if you are exposed to the virus, you have to adhere to the requisite days in quarantine. Um, Amr
Absolutely.
from Facebook asks, if a person completed 14 days of quarantine, are they still contagious?
So it's important to sort of understand the terminology. So quarantine is typically when we talk about people who may have been exposed to the virus. Um, if he's worried about being contagious, he might be worried about isolating. And so the reason we've come up with a 14-day quarantine is because that's the time where, you know, the data would show if you're exposed to someone who has COVID-19, we would expect the vast majority of patients to, if they're going to become infected within those 14 days. If Amr was exposed to someone and at the end of 14 days had not developed symptoms, one could say that he may not be infected, but ideally what you would want to do is test him to make sure he's not one of those asymptomatic shedders. And at the end of 14 days, if you have a negative test, then you would feel confident saying that you do not have COVID and can come out of the quarantine.
I have another question from Stephen from LinkedIn, who asks, what about reinfections and the challenges, if any? Have you seen this in Wisconsin?
So we're still learning about reinfection. There's been lots of different case reports and things we're sort of all waiting and watching to learn more about. I don't think that, because we know that a PCR test, when someone tests positive for the virus, and many patients can stay positive for several weeks. I think some of the patients we've seen coming back to the hospital ill even several weeks after their initial infection, that the positive PCR in that case is not due to a reinfection, but rather persistent detection of virus. It may actually be dead virus, not that they're felt to be infective at that point. But this is something we're still learning more about. And I think, as you know, this has been such a learning curve for everyone involved with COVID-19. We're going to continue to learn more and hopefully be able to answer those questions more definitively in the coming months.
Well, Dr. Schwartz, thank you so much for taking the time to be with us. I know you're shouldering a lot out there in Wisconsin. I wish you luck, and please stay safe.
Thank you. I very appreciate it.
All right, if you're just joining us, this is The Road to a Vaccine, an exploration of the COVID-19 crisis and the global community's efforts to develop a vaccine against the disease. Now, we've talked a lot on the show about disparities during the pandemic and how COVID-19 is impacting communities of color. A very important voice that has risen to the forefront of the conversation is Dr. Uche Blackstock, ER physician and founder and CEO of Advancing Health Equity. Dr. Blackstock, thank you so much for joining us. I've been wanting to have you on the show for a long time. Now you have referred to COVID as the pandemic of inequities. Can you explain what you mean by that? And what are the conclusive reasons communities of color are experiencing higher rates of mortality rates due to COVID?
So first of all, thank you so much for having me on, Lisa, especially to speak about this very important topic. And so, the reason why we say it's a pandemic of inequities is that there were inequities, racialized health inequities, even before the pandemic. But what the pandemic did was expose and amplify these really deeply rooted structural inequities. And what we're seeing is among Black, Latinx, and Indigenous populations in the countries, we're seeing some of the highest infection rates, hospitalization, and mortality rates. And as we go through the pandemic, those rates are actually increasing. And so while coronavirus has affected all Americans, it has disproportionately affected Americans from the most vulnerable communities. And these communities are vulnerable because of the legacy and current systemic racism. And when we think of all of the factors that have predisposed these communities to being infected, they're including carrying the highest burden of chronic disease. And there's nothing biological about that. That's as a result of factors related to systemic racism, like lack of access to healthcare, lack of healthy foods in your community. But also there are other factors like being more likely to be essential and service workers. So working in public-facing jobs that increase your risk for being infected and not having the luxury of working from home. Additionally, these communities are more likely to take public transportation because car ownership rates are lower, again, linked to income and wealth. And as well as, we talked about jobs, we talked about transportation. And so all of these, and then also overcrowding in apartments, more likely in these communities to have multi-generational families, so leading to infection rates across a spectrum of ages, as well as not having the luxury to physically distance. And so when we talk about being able to physically or socially distance, really that is only a luxury that certain Americans, usually of higher income, can take advantage of.
And now, as we are, gosh, almost 10 months into this crisis, what are some of the solutions to those things, Dr. Blackstock? I mean, we're talking about so many sort of, so many layers of systemic injustice and racism that has just permeated so many communities of color. What are some of the concrete solutions that could be, we could use to address those issues?
Right, and this is such a great question, and it's not one that has an easy answer. In the short term within this pandemic, and I was really excited to see this in the 7-point plan of the new Biden-Harris administration. But one of the points was actually to address racial health inequities in the pandemic through funding for testing. And so what it's all about is equitably allocating resources. And so what we know and from the data is that there's not the same amount of testing availability in these communities, that often community members have to wait on a long line to be tested, and then there are testing delays, which eventually it makes it even unreasonable to be tested. Like, what's the purpose of being tested if you have to wait a week to 2 weeks? You could even spend that time infecting other people. And so we need testing, tracing, isolate to happen, but also we also need to make sure that people have healthcare insurance. So a lot of the Medicaid expansions that we saw, previous to the pandemic, have actually helped communities because we know that in Black and Latinx communities, we've seen the highest rates of job loss. So employer-sponsored health coverage has been lost. But fortunately, some of the states where we've had Medicaid expansions, people were able to keep their health insurance. And so we need to focus also not just on individual level, but also policy level solutions, funding community health centers. I think in this time, we need to be more innovative about how do we test, mobile testing, bringing the testing to where the people are, schools, churches, community centers, working with trusted leaders in the communities is also important. There's also a role for community health workers, who are people from the community. They're trained, they know community members, and they're able to engage with them in a way that hospitals, healthcare institutions are not able to.
Do you see those things starting to happen in communities where there is so much need?
Well, yeah, and I think that because, one of the problems that we don't have a national strategy to curb the coronavirus. So that's one problem. And so it's really been up to state and local leadership to really put forward and implement these programs. And I know here in New York City, our Department of Health, which is one of the leading departments of health in the country, has really made a point of getting testing out to these communities, but also working with neighborhood coalitions and community-based organizations to ensure that the messaging is getting out there. Because what we're seeing is that among different communities, there's varying degrees of health literacy around coronavirus. And so it's important to know what are the protective measures that you need to take, because we know that once people understand what they need to do, they'll do it. But the public health messaging has to be culturally responsive. Especially, it's not a one size fits all. It depends on the community.
You mentioned that we haven't had a national strategy. I imagine you're probably feeling more hopeful now that President-elect Biden has really, his first order of business, even before he has become president, is to set up this coronavirus task force, and seems
Absolutely.
to be taking it a lot more seriously.
Oh, absolutely. I felt hopeful for the first time in a very long time this past weekend, because as we've seen, and you mentioned a little bit earlier, other countries have had a coherent comprehensive strategy for coronavirus. And we know that there are tried and true prevention measures to help curb the virus. So we know that if we were to have even a nationwide mask mandate, if we were to give the appropriate funding needed to have a robust testing and tracing infrastructure, that we could actually get this virus under control.
Dr. Blackstock, I have a question from Alec from LinkedIn who asks, do you feel that the companies working to implement a vaccine are adequately ensuring that racial inequalities are addressed in the test phases of the development?
And Alec, that's such a great question. And I think what we've seen, and this has been an issue for a while in clinical trials, that there has not typically been a diverse representation of participants in those trials. But what we've seen in this pandemic, though, it's been communities of color that have been disproportionately impacted. And so I have seen a few of the companies really try to make an effort and try to make some headway into engaging with communities of color, especially Black communities, in order to recruit participants into the trial, because I actually think that it's important for multiple reasons to have a diverse group of participants. While there's no biological basis for race, we do know that racism shapes the health of people in this country. And we've also seen it disproportionately impact communities of color. But I also think that once a safe and effective vaccine is available, I think that people will be more willing to take it if they see that there have been Black people, Latinx people, Indigenous people involved in the clinical trials themselves. They'll be able to really engage with more trust in the vaccine process.
I want to ask you about the fields of medicine and science themselves. You know, the pandemic has really highlighted inequities in those fields. How can we combat this? And what would you say are some solutions? And what do you think a full examination of equality in these fields would look like today? And where does it need to be?
Yeah, no, I think that a real truth and reconciliation process needs to happen in medicine and in science. We have a very horrific history of exploitation and abusing communities of color, particularly Black communities in this country around research, actually, specifically. And so, I think that it starts in many different ways. It starts with healthcare companies and institutions really putting funds into the community, into pipeline programs for children. That one of the issues that we have is lack of diversity among in the workforce. And one of those reasons is because our educational system is unequal. So I think that healthcare institutions really need to take it upon themselves to address those issues, funding mentoring programs, sponsorship programs, and then that will help the pipeline. But I also think organizations need to look internally and prioritize anti-racism. Right? It has to really be at every level of the organization, embedded in their strategic plan. And then when they're developing policies, practices, programs, use a lens of racial equity to think about what groups are being advantaged or disadvantaged. Are we engaging the community? Do we need to do more? And what are some measurable outcomes that we need to keep in mind?
Absolutely. This really is such a unique inflection point in this country and in the fields of science and medicine. Michelle from LinkedIn is asking, what has your healthcare system done to support the mental health of your workers and in the community?
That's such a great question. And to be honest, I think that what we've seen in terms of mental health programs have been very grassroots. They've been from psychologists and psychiatrists across the country that have seen the trauma that healthcare workers have endured. And so while I don't know of any specific healthcare organizations that have, put efforts to this, I know that there are grassroots programs out there, and hopefully there'll be a more concerted effort, because after this pandemic, everyone is going to need therapy, if not during.
I couldn't agree with you more on that. Dr. Blackstock, in addition to being an ER physician, you are a very outspoken advocate for health equity. What drives you personally to speak out, and how have experiences in your own life informed your work?
Right, thank you for asking. So I am a second generation physician. My mother was the original Dr. Blackstock. She was a physician but grew up in very different circumstances than I did, in poverty, and had to really overcome tremendous structural systemic barriers to become a physician. And so a lot of the work that I do is in her memory. But I also feel a very strong obligation to giving back to my community. And given, as I mentioned, the history of systemic racism in this country and how it has really shaped the health of Black communities in particular, really is what spurs me forward and makes me committed and being purpose driven in doing this work.
What an incredible family you have. Anas from LinkedIn asks, how do we advance the health sector to prepare for the next pandemic?
Yeah, and I think that what we saw in this pandemic is because we had defunding of our public health infrastructure, right? We actually had, whether intentional defunding of it. And so I think what we need to do is, once we get this pandemic under control, is we need to make sure that we have that infrastructure in place for the next time, to look at the lessons learned from this pandemic, right? That we know that we need to be able to ramp up testing very quickly, right? We know that that was one of the issues that we had very early on in the pandemic. And so disaster preparedness is really going to be a key issue as we move forward.
You talk about the distrust in some communities of color regarding healthcare and vaccines. And a huge component of managing COVID is really the public health, the communication around it, right? So how can we improve communications regarding healthcare in communities of color? And how can medicine and science really instill that trust in safe and in vaccines?
Yeah, I think for far too long, healthcare institutions and organizations haven't really engaged with the communities that they care for, or that their products or medications go towards. And so I think at a very fundamental level, there needs to be engagement with community-based organizations. You need to have community partners, because in the long term, that messaging around coronavirus, around the vaccine, is going to be crucial. And healthcare institutions and organizations cannot do that on their own. The messaging needs to be nuanced, and it needs to be culturally responsive, but also you need to look at, who is that message coming from? While Dr. Fauci is amazing, and I, as a physician, listen to him, the average person walking down the street may not listen to him. They may be able to listen more to their pastor or to their coach. So we need to think about really, getting into communities, asking communities what they need, finding out what the concerns are. And I think also being more transparent about the vaccine development process and the approval process is really going to be crucial. People need to know that this is a safe and effective vaccine. And I think they'll know this if everything is sort of put forth, right? If all the steps in the trial and the approval process, and knowing that this vaccine was vetted and is safe, really will influence vaccine hesitancy and distrust in these communities.
Well, that's why you exercising your voice is so important. Dr. Uche Blackstock, thank you so much for taking the time to be with us, and we hope you come on again. Thank you.
Thank you for having me.
Now, this week is International Week of Science and Peace, and to mark the occasion, we have Anika Chabrolo, a remarkable 14-year-old young woman from Texas who recently discovered a compound that can bind to the coronavirus and inhibit its ability to infect people. For her groundbreaking work, she won the prestigious 3M Young Scientist Challenge. She couldn't be here with us today because she is in the middle of school, but I caught up with her earlier this week. Take a look. Anika, congratulations on winning the challenge. Now, I heard, you're 14 years old, I heard that when you originally started, it was for another idea or another kind of treatment, but then you changed directions to focus on a treatment for COVID. So what inspired you to make that change? And I think you were, what, in 8th grade when you first started?
Yeah, I had the initial idea actually about 2 years ago, and it really progressed in 8th grade. That's when I actually started going on with the process. And I did the influenza virus previously, but around the time that I got chosen as a finalist for the 3M Discovery Education Young Scientist Challenge, that was when the coronavirus was at its initial peaks. So with the help of my 3M mentor, Dr. Mahfouza Ali, I decided to pivot and change to the SARS-CoV-2 virus, because that obviously has made much more of an impact around the world in less than a year, so way more than the influenza virus has done.
And what is it about science that really intrigues you and made you want to pursue it, pursue the field? How old were you when you thought, like, Wow, this is something that I can do. This is something that I might be really good at.
When I was younger, my grandfather actually always used to encourage me into science, and we used to do all these science experiments together, and he used to learn and teach me about the periodic table of elements and all those small little things. And over time, it kind of grew on its own. My love for science, it kind of just grew, and then my passion also grew as well for it. And then about in sixth or seventh grade, that's when I started actually looking at the world and seeing how I could use my knowledge of science to actually solve problems and current problems in the world. I think my favorite part about science is basically how it inspires curiosity. It gives us the ability to ask questions because almost everything in the world can be answered through science. So that's one of my favorite parts about science.
I love that, Anika. I am not a scientist, so would you help me explain in layman's terms what your study is about and what the findings were?
So in my study, I worked to find a potential antiviral against the coronavirus. So to do this, I needed to find a molecule that can best bind to the spike protein of the SARS-CoV-2 virus, because this could be the best potential to provide a potential antiviral against the coronavirus. So how I went about doing this was I found a molecule out of a database of about 698 million compounds that showed the best potential to bind to the spike protein. So why did I do this though? So why did I go from such a big database? So you want to find the molecule that has the best results, whether this be in the binding tests, which would be how best the molecule can bind to the spike protein, or this can be in a test for ADMET properties, which is basically to see if a molecule would have potential adverse effects in biological systems. So after testing for all these properties, and after testing for many results, I figured out which molecule out of this database would provide the best potential to bind to the spike protein. But why bind? By binding to this protein, you get to change the shape because of something called induced fit. So when the molecule actually binds the specific spot on the spike protein, it changes the shape of that specific place on the spike protein. If a protein changes its shape, it's not able to function as it normally does because a protein is super specific. So if it changes just a slight bit, it's not able to work as it normally would do. So the initial function under normal circumstances, if it was at its normal work life, I guess, the spike protein would be its main role would be infecting and entering host cells. So by finding a molecule that can actually bind to it and change the shape of the protein, we'd be able to change the function. And by changing this function, the initial one would be infectivity. So we would stop the virus from infecting and entering host cells.
Now, Anika, I know that you just completed your research and your findings. So the plan is to bring it to virologists. And then what? Like what does the sort of immediate future look like for your project?
So right now, I just finalized the virtual part. So what I did was just the in silico methodology. That's the first stage of drug discovery. The next step would be to do in vitro testing, and then in vivo testing. In vitro testing is lab testing. So you're testing on cells in an artificial environment. So not anything super complicated yet. Later, you start testing on bioprinted organs, so artificially created organs. And then you go further into more complex biological systems until you actually get to humans, where you get to human clinical trials.
Anika, you've gotten a lot of media attention. I've seen you all over the place. What has all this been like for you? And have any interesting doors opened up for you?
It's honestly been really exciting, really amazing to see just how I can collaborate with new people, and it's allowed it's allowed a large network of people to open up to me and a lot more collaboration opportunities. I get more of an experience with contacting scientists and more laboratories and more drug development specialists. I just have this new platform where I get to see everyone's support and then get to support others. And I also like to use my platform that I recently gained to support STEM and encourage STEM because, again, not a lot of children get the same opportunities that I did to pursue a STEM education.
And you are in school, you're a freshman in high school. Are you actually in person? Are you doing it virtually? And how would you assess how the strategy regarding school is working right now, at least where you are?
So we get a decision to choose if we go to in-person and virtual, and I chose virtual learning for this year for school.
And why did you do that?
Well, personally, my family, my grandparents actually live in my house, and the coronavirus affects elders mostly, and it takes a drastic impact on them. So I just wanted to keep my family safe, especially because I have my grandparents living in my house.
So I know you've been working hard on this project, and when you're not trying to save the world, what else do you do for fun?
I've actually been doing Indian classical dance for about 8 years now. It's just one of my side hobbies that I really like doing, and I actually had to beg my parents to let me join when I was younger, but it's just a really amazing thing that I like to do.
I'm just curious if you have thought much about your plans for the future.
Yep, right now I want to continue my research and I want to continue with this drug development and contact virologists and drug development specialists for the next stages of my project. And in the future, I do want to become a medical researcher.
Have you felt you know, in your science classes and the clubs and so on that you've been in, have you been one of the few girls, or are you seeing more and more girls?
Yeah, I actually am seeing more and more girls. I think that's a really amazing thing that's happening. I do like to see like a lot of females and more empowerment in science because that's important. We need an equal representation of females.
So in the groups that you're in, you're not the only girl.
No, I'm not. A lot of children and kids my age in my area are really interested in science, a lot of girls especially. And I think that's a really amazing environment to be in. And I hope a lot of other children get to have that same environment because I know that not a lot of people get that support for girls especially.
Are there scientists that you admire and look up to in particular?
Yes, there's Marie Curie. She is the first female to ever win a Nobel Prize. I think that's really amazing because people don't support females, especially in her time. Not a lot of people supported her when she felt like going into science, when she wanted to pursue science, when she wanted to put forward her research. So I think it's really amazing that she won that and she got to get that recognition.
Yeah, Marie Curie made such an impact on science. Do you think that you will make as much of a name for yourself? I mean, at 14 already to have won this prize is just so impressive and significant.
Well, I do hope to do more. I do hope to accomplish a lot more. I do hope to extend my research and do a lot more with it. And we'll see where that goes.
Okay, well, Anika, we are so excited for you. Thank you for taking the time. I know you've been so busy and we wish you so much luck.
Thank you so much for having me. It's my pleasure.
To say that I was impressed would be a gross understatement. That was the brilliant 14-year-old Anika Chabrolu, and it goes without saying that the future looks so bright for her and all of us as possible beneficiaries of her work. Now, as cases climb around the world, healthcare workers continue to meet the incredible need created by this pandemic. We caught up with two ER physicians who've been on the front lines of this pandemic since March.
I'm an emergency medicine resident physician practicing in San Antonio, Texas.
I'm an intern doctor at Victoria Hospital in Bangalore, India.
One of the things that I vividly remember is patients that I admitted to the ICUs or to the medicine because they were requiring high levels of oxygen therapy or requiring ventilation, going home, maybe having a day off, coming back 2 days later, and they were still in the emergency department. There was no room for them to move upstairs, and we simply don't have the resources and the nursing staff to take care of new patients coming in and then at the same time take care of those that are very, very sick.
We had our peak in October, the beginning of October, and steadily the number of patients coming into the hospital increased, much more than what we saw in March or April. The beds were almost completely full in public hospitals and even in private hospitals, so much so that even people with resources and money and connections could still not get a bed, even with severe diseases.
Even though it seems like case numbers are coming down, we still have hotspots all across the Midwest. And as we're going back to college, schools, and work, we're expecting to see those numbers rise again. We all know that the general coronavirus family of Viruses stay on surfaces longer and thrive in colder temperatures. And as we head into this colder season with the flu as well, it's going to be very, very tough unless we take the strictest of public health measures.
So the number one lesson that I think we need to learn, another lesson I think most of us have learned, is that we need to be humble. As physicians, we think that we know a lot about a lot of things, but I think the virus has shown that there is still a lot that is left to be learned.
My deepest thanks to those ER physicians and to all healthcare workers who have been on the front lines battling this pandemic. Now, as we look ahead to the coming weeks, it is with a sense of urgency as temperatures drop, forcing people inside, and as the holidays approach. This really is a time for all of us to come together and strictly adhere to the guidelines to beat this virus. At this point, it is all we really can do. I'll quote NIH Director Dr. Francis Collins, who just days ago tweeted, quote, "If everyone would wear a mask when they go out in public, more than 130,000 COVID-19 deaths could be prevented by this winter," end quote. He advises us to follow the 3 W's: wear a mask, watch your distance, and wash your hands often. That is it for this episode of The Road to a Vaccine. We will see you next week.